Namaskar, I am Dr. Damanjeet Kaur, Consultant Psychiatrist, Faith Hospital, Chandigarh. Today I will be discussing a topic which is men's mental health. Since November has gone by, and that was the month which was observed as a month for men's mental health internationally. So I will be discussing mental health issues related to men. Our society consider men to be physically stronger gender. From a young age, boys are told to remain strong enough and to tackle their own problems independently on their own. The journey from boys to men is forged under constant pressure to remain strong enough throughout their life, and showing their emotions or talking about their mental health is considered to be as the sign of weakness. The stigma around the mental health in our country or in the world has goes deep into generations and is there in every layer of the society, be it a man or a woman. But good mental health is just like oxygen. We need it to survive. So, but the men, they are less likely to speak about their mental health, and there are so many reasons. This could be because they are told that they are not the weaker gender, and if talking about their emotions will be considered as the sign of weakness. They are under constant social pressure of to remain strong enough in the society. Number three, they feel that if they talk about their emotions or mental health, they will be judged in each and every work they would do. And fourth is the toxic masculinity norm which prevails in the society. That is, from the very beginning, they are being brought up to remain tough enough. They are told to tackle with their own problems on their own independently, and they are also told that if they talk about their emotions or they show their vulnerability, they will be losing their authority on others. They have that fear. And fifthly, men also are more likely to get involved into the harmful methods of coping, just like into drug abuse or substance abuse or alcoholism, which are again used as wrong methods for coping against anxiety and depression. How is depression different in men? Depression, it is said that amongst men or women, the depression is twice as common more in female genders than in male gender, but there are symptoms which are quite different from the females. These can be irritability, loss of temper, aggressive behavior, and loss of self-control or risk-taking behavior. This can be seen more commonly in men than in women. Also, there is men shows the escapist behavior by, if they are under anxiety or depression, they get indulges more into the work. They use harmful coping methods to deal with their anxieties in the form of getting indulgence into more in drug abuse and alcoholism. Loss of loved one or financial instability in the work is also a stressor which is more commonly affects men than in females. And in our society, marriage is considered to be as a booster for the mental health. You get a companion or a friend to talk to, that reduces the chances of depression. But marital strife, divorce, or death of the spouse can lead to anxiety and depression amongst men, but they could not able to speak up about their emotions, and rather speaking up, they get indulged into alcoholism or substance abuse, which is again seen in the society in the form of as lack of willpower to stop them or lack of self-control, but it is not seen as it could be an alternative method to cope up with the anxiety and depression. So if a person is involving into alcohol or substance abuse, it is said that he is not able to leave them because he has lack of willpower. So if someone is listening to me right now and facing emotional issues, I just want to tell you that no one is immune to stress. Talk about it with your loved ones, near and dear ones. Speak up, because speaking up will give you a help which you could not do by yourself. No one is immune, be it a male or a female, and there are good medical treatments are available, and there is always a hope involved in it. So it is not the sign of weakness, it is not the sign of cowardness. Speak up your emotions, eat properly, and remain active as much as you can. If someone of your loved ones is suffering from such emotional issues, I just want to tell that let them know that you are there to listen to them without judging them. Make them assured about it that you are there to listen to them without judging them. Number two, sometimes it is difficult, it is hard to reach out for help. So keep in touch with them. Number three, help them to reach out to the help. If they are depressed or they are anxiety or they are having emotional issues, help them to seek medical help. Lastly, if you are a caretaker or a caregiver, your health is also as important as your loved ones. So take care of yourself, your mental health is more important, then only you will be able to take care of the others. There are some symptoms or signs which you need to look out for. If these are present, you or your loved ones need medical help. Number one, there is change in the mood, change in the sleep, change in appetite, there is change in the weight, sudden increase or loss of weight. There is ideations of suicidal ideations or hopelessness or worthlessness, or there is more indulgence into drug addiction or substance abuse or alcohol addiction. Lastly, I insist all of you that speak up your emotions, speak up about your mental health, be it male or female. Let's destigmatize the mental health issues and talk about it without any fear. Maybe we can save a life. Thank you.